Hello everyone, I hope everyone is fine. In this video we are going to talk about the cardiac rhythm, which is very important for the understanding of the normal functioning of the heart and also knowing about the abnormal rhythm of the heart against this normal rhythm. But before that, I'm going to thank you guys for your response, and I am humbled by that response. And this is helping me hugely to grow the channel. I'm extremely thankful to all of you guys and your response. And if at the end of the video, if you like the video, then I request you to subscribe the channel if you haven't done it yet. And I also request you to press the bell icon. That will help you to get every next video the moment it is uploaded. And if you like the video, at the end of it, you think it is helpful to someone else as well, then please share the video at any forum. Thank you so much once more. Now, when we are to talk about the heart rhythm or the cardiac rhythm, then there are certain important factors which we need to remember. First thing is that our pulse is generated by the systole and it is followed by the diastole. But before that, there happens depolarization and repolarization of the atrial and ventricular muscle. But even before that, there happens an event in the sinoatrial node, which is located in the right atrium at a place or a junction where superior vena cava enters into it. Now, this sinoatrial node automatically fires impulses at a rate of 60 to 90 times per minute, and these impulses travel through the intra-atrial fibers, and one of those fibers are the Bachmann tracts. And these fibers then depolarize the atrial muscles, which creates or generates P wave on the ECG paper. This is the P wave. Now, once it has depolarized the atrial muscle, it enters into the atrioventricular node, which is located at the junction of the atria and the ventricle. And this is the only point where this impulse transmission is delayed for a very brief period of time. At this point, AV node or atrioventricular node. And this short delay generates the PR segment, not the PR interval. PR segment is from the end of the P wave to the start of the QRS complex, whereas PR interval is from the start of the P wave to the start of QRS complex. So there is a difference. PR segment represents the time travel when the impulse passes through AV node and is delayed for a very brief period of time. From here, it enters into the bundle of His, and it then speeds up through the right bundle branches and the left bundle branch, both of its left posterior fascicle and left anterior fascicle. Both the right bundle branch and the left bundle branches, they have got very fine fibers on their end which are embedded into the ventricular muscle, and the depolarization of the ventricular muscle causes the formation of the QRS complex. Now, the QRS complex is caused by the ventricular depolarization, and ventricular depolarization is followed by the repolarization of the ventricle, which is represented on the ECG paper as a T wave. Now, there are certain facts which we also should remember, that this sinoatrial node, it fires at an rate of the 60 to 90 times per minute, and it fires automatically. Nothing asks or stops it to fire. So it keeps on firing at a rate of 60 to 90 times per minute. The average time is 72 per minute. These impulses, they are thrown towards the atrial muscles at a rate of 72 times per minute. Or you can say, if we divide because there are 60 seconds in 1 minute, and in 1 minute you have got 72 beats. So if we want to know after how much time a single beat comes one after the other, we will divide 60 by the 72, and the answer is 0.8 seconds. So after every 0.8 second, there will be an impulse transmission from the SA node. So, and this impulse causes the atrial depolarization, which generates a P wave, and it is then followed by the ventricular depolarization, which generates the QRS complex. So P wave is always followed by the QRS complex. In other words, atrial depolarization is followed by the ventricular depolarization after a fixed amount or fraction of the second. Here in this example, this is 0.8 seconds. So we can say that the normal rhythm of the heart, and by normal rhythm of the heart we means that how the atria and the ventricle, they depolarize in harmony with each other. Now the normal sinus rhythm of the heart is generated by the SA node or the sinoatrial node, and that is the reason that we call it the normal sinus rhythm. Normally it is generated by the sinus node or sinoatrial node, and this is why we call it the normal sinus rhythm of the heart. Now there is a specific definition of the normal sinus rhythm, because now we have seen that why we call it normal sinus rhythm, because normally the sinus node maintains the rhythm of the heart. So what is the definition of the normal sinus rhythm? The definition is that there should be a P wave present before each QRS complex, because atria depolarizes first and then it is followed by the ventricular depolarization. So P wave is present before each QRS complex. First part of the definition. And the second part of the definition is that R to R interval will be regular. This is a definition of the normal sinus rhythm. You can take a piece of the paper, you can mark the 2 R waves duration, and then you can place it on the rest of the ECG. That will show you that R to R interval is regular. So the definition of the normal sinus rhythm is P wave should be present before each QRS complex. This is P, this is P, this is P, this is P, this is P. And QRS complexes are R to R interval should be regular. If there is no R wave somewhere, for example in lead V1, V2, that has got a very small R wave and a deep S wave, then you can compare the duration of the S, one S from the other, that will be regular. So this is a definition of the normal sinus rhythm. Now the question arises, why we want to know about the normal sinus rhythm in first place? Why it is important to know whether this patient is having the normal sinus rhythm? Because this is the only way to compare the normal sinus rhythm with the arrhythmia. Arrhythmia means the absence of the rhythm. A stands for absence, like the asepsis, when there is no sepsis. So arrhythmia, they are compared only if you know that what is the definition of the normal sinus rhythm. For example, this example is that of the atrial fibrillation. Now what happens in atrial fibrillation? That there is no identifiable P wave present and R to R interval is irregular. This is the definition of atrial fibrillation. From where we got it? Because in normal sinus rhythm, P wave will be present before each QRS complexes and R to R interval will be regular. So same way we can also define SVT against the template or normalcy of the normal sinus rhythm. So in normal sinus rhythm, P should be present before each QRS complex and R to R interval should be regular. But in case of the supraventricular tachycardia, there is no P wave present, R to R interval is regular, and the heart rate is more than 150 beats per minute. So this is the definition of SVT. Now knowing about the normal sinus rhythm is very important, because this is only how you can talk about the presence or absence of the arrhythmia, including the atrial fibrillation and the supraventricular tachycardia, which is SVT.